Most Medicare Advantage plans have a drug plan as part of them, so that is an additional benefit. Some of them also have other benefits as well, such as they participate in the Silver Sneakers program, which gives you access to different gyms. They might also offer dental, they might offer vision, and these are things that you're not going to get in a Medigap plan, as well as a prescription drug plan.
Are you ready for a successful retirement? We're addressing the topics facing today's retirees. Welcome to Retire with Ryan. Now here's your host, Ryan Morrissey.
Welcome back. This week, going to continue along with talking about health insurance. As last week I talked about your options for health insurance before age 65, but now we're going to talk about your options for when you turn 65. So you may remember from last week, I mentioned that once you turn 65, you are eligible for Medicare. And you have some options once you reach 65. If you're still going to work past 65, you can continue on your employer health insurance, or if your spouse is working past 65, you could also continue to be covered under their health insurance and decide to delay Medicare coverage. You have the ability to keep working and your employer plan exempts you from enrolling in Medicare to delay your enrollment past 65. And you'd want to check with your employer to see if your plan allows you to not enroll in Medicare. Generally, if your plan that you're part of covers 20 or more employees, then you'd be able to delay your enrollment. But if it doesn't, you'd want to make sure that you enroll in Medicare, because if you don't enroll in Medicare, you'll have to pay a penalty based on the amount of time that you don't enroll in Medicare. And that penalty is 10% for every 12 months that you don't enroll. And that's a permanent increase that you'd have to pay on your Medicare premium. So Medicare has a few different parts, and it can be confusing. There's Part A, which helps to cover part of the cost of a hospital stay. It covers some limited nursing care. It also covers hospice care, limited home health care. And this is generally free as long as you or your spouse has had 10 more years of paying into Social Security, then this is free to you. And then there's Part B, which is sometimes called Original Medicare, which helps cover part of the cost of doctor's bills, outpatient surgeries, emergency room visits, ambulance services, diagnostic tests, laboratory services, durable medical equipment. You pay an amount per month that Medicare sets each year. This year, the monthly Part B premium starts at $144.60. Next year, that number is going to be $148.50. And depending on how you file your taxes and what your modified adjusted gross income is in the prior year, could determine if you have to pay anything above that standard monthly Part B premium. And the numbers have come out for next year. As a single filer, if your modified adjusted gross income is over $88,000, then you'll pay an additional $59.40. And as a joint filer, if your modified adjusted gross income is over $176,000, you'll also pay that additional $59.40. There are additional increases as your modified adjusted gross income goes up above that. The maximum that you could be paying would be $504.90 if you had significant income in retirement. And I'll put a link to where this information can be found in the show notes. Now, though Medicare Part B covers a lot of these outpatient procedures, it only generally covers 80% of those costs. So the things that it doesn't cover, and that other 20%, you either have to pay for yourself out of pocket, or you can choose to add an additional coverage that can provide for those costs. So one option is that if you happen to have a retiree health insurance benefit, that could be your supplemental plan. Medicare is always your primary insurance once you're enrolled in Medicare, but your retiree supplemental plan could cover the things that Medicare doesn't cover, or that 20% coinsurance. But if you don't have retiree health insurance, then your next best option is to go one of two routes. And that's either choosing a Medicare Advantage plan or a Medigap plan. Now, Medicare Advantage are plans that are offered by different insurance companies depending on the state that you live in, and the insurance company itself decides what is going to be offered in that plan. So if you're in better health, then you could possibly go into a Medicare Advantage plan. You can possibly even get some of these plans that don't cost you anything. So you'd be paying for your Part B premium, and you might be paying nothing for your Medicare Advantage plan. And that would help cover the cost of your coinsurance, certain doctor's visits, maybe even cover your deductible for a hospital stay. However, there are limitations with Medicare Advantage plans because of the fact that they are very low cost and the plans vary. You might want to get more of a comprehensive plan, and that's where you could decide to get a Medigap plan. Medigap plans are standardized. There's 10-letter plans that you can select from, and it is confusing because there is a Medigap Plan A, and that's not to be confused with Original Medicare Part A. And those plans range in cost based on what's provided in the plans. So a good place to go anytime you're looking up information on Medicare is Medicare.gov. And if you were to go there and you looked at the different plans, you can see what's covered in Plan A versus Plan B. And it used to be the most comprehensive plan. Well, it still is the most comprehensive, was Plan F. However, if you didn't reach 65 before January 1 of 2020, you can no longer enroll in Plan F. So if you have Plan F, then you might want to decide to keep it because that is the most comprehensive plan, and there's very minimal amount of money that would come out of your pocket, though it is one of the most costly monthly premiums that you're paying because you're not having to pay very little of anything out of pocket for the majority of procedures that you could have. The next most comprehensive plan to Plan F is Plan G. And where the difference being that with Plan G, you have an outpatient deductible that you have to meet. I believe for this year, that's $198. And after you meet that plan, that deductible, that plan is very similar to Plan F. And then another good option sometimes people choose is Plan N, where it's less costly than Plan G, and you'll have to pay some copays, but the premium is less on Plan N than it would be on Plan G. So it really depends upon your health, whether or not you want to go the route of a Medigap plan or you want to go the route of a Medicare Advantage plan. And you'd want to look at what these plans provide, but then once you decided if you were going to go with a Medigap plan, you'd want to shop the plans and you'd want to go with just the least expensive plan. Because insurance companies that offer these plans, they set the pricing on these plans. So if you're looking at Plan G, for example, and you were comparing between Aetna or Cigna, the plans are going to be identical because the Medicare actually sets, based on the letter plan, what has to be covered, and the insurance company has to provide everything that is required. So you'd want to go with whatever's going to be the least costly plan. Another benefit of a Medigap plan over Medicare Advantage is that these plans are national plans, meaning that you could most likely see any doctor in your state and also travel and see doctors out of state, and that would still be covered in your plan. So if you're going to be splitting your time between Connecticut and another state, or maybe just between multiple states, then you maybe want to consider going with a Medigap plan as your supplement because most likely you'll have very little out-of-pocket costs. Whereas a Medicare Advantage plan, the reason that they're able to keep the cost down on those plans is that the plans operate more like an HMO where you have a network of doctors that you can see. And if you go outside of that network, then you end up having to pay more money out of pocket. And this could even be within your state, that within a certain geographic area, there's only certain doctors that you could see. And then if you go out of that area, now you're falling into an out-of-network plan. So that's one of the things you'd want to investigate before you went into any Medicare supplemental plan is, do the doctors you see, are they going to be accepted with this plan? And also looking at the drugs that are available in the plan, are they going to be accepted as well? Most Medicare Advantage plans have a drug plan as part of them, so that is an additional benefit. Some of them also have other benefits as well, such as they participate in the Silver Sneakers program, which gives you access to different gyms. They might also offer dental. They might offer vision. And these are things that you're not going to get in a Medigap plan as well as a prescription drug plan. So if you go the Medigap route, you're going to have to decide on a prescription drug plan. And there are different options available to you. Just like looking at the Medicare Advantage plan, as far as what prescription drugs are covered, you'd want to look at the different Medicare Part D prescription drug plans, looking at what drugs are covered and looking at what you're taking to decide which one of these plans that might be a fit for you. One other thing I should mention with prescription drug plan Part D is that if you don't enroll in prescription drug plan Part D within 63 days after your initial enrollment period, you could also have to pay a penalty that's equal to 1% times the average national premium per month for every month that you're not enrolled. Or you didn't have credible prescription coverage that would take the place of Medicare prescription Part D. An example of that would be either enrolling in Medicare Advantage, or if you have supplemental employer plan, you'd have to check to make sure that it allows you to exempt from enrolling. And because it could make sense just to enroll in Part D if you don't have employer coverage and you're not going to go with a Medicare Advantage plan, just to make sure that you have this coverage so that you don't end up having to pay this penalty later on. And another thing to think about as well is when you are first enrolling in Medicare, you have a choice whether you go with a supplemental plan or not. And during the initial 6 months where you're eligible for Medicare, if you go straight into a Medigap plan, there is no medical questions that you have to answer and no medical underwriting that you'd have to go through. If you then later on try to go over into a Medigap plan by either going into it after the 6 months is over, or even if initially you went into a Medicare Advantage plan, but now you've decided you want to go into a Medigap plan, there are medical questions that you have to answer, and you could be denied going into that Medigap plan. So if your health isn't as good, or you're concerned with having to pay more out of pocket later on, and you feel more comfortable knowing that even though you're paying a higher premium, you might want to go with a Medigap plan initially so that you're covered in the plan and you have no issues later on deciding to switch. So getting back to the initial enrollment period, there's a few things that you have to be aware of. So if you end up collecting Social Security before 65, generally you're going to be enrolled right away in Medicare. You'd have to ask them for you not to be enrolled. The other way you could be automatically enrolled in Medicare is that if you happen to qualify for Social Security disability, once you've been collecting Social Security disability for 24 months, you will also be automatically enrolled in Medicare as well. Outside of that, once you are no longer covered by a group plan or your spouse is no longer covered, now you need to enroll in Medicare once you reach your 65th birthday. And you have 3 months to enroll before your 65th birthday and the month of your birthday, and also 3 months after. So you have an initial enrollment period of 7 months. And you'd want to probably enroll at least 3 months before you hit that initial enrollment age, right, that birthday. And that way you'd get signed up for Medicare, you'd get your card in the mail, where you then would be able to start shopping for your supplemental plans. If you wait longer than that, then you could end up having to wait past your 65th birthday to actually have your coverage start. Now, if you are someone who's going to work past 65, or you're already past 65 or your spouse is going to work past 65, then you have another enrollment period, which start beginning the month after you lose coverage, health insurance coverage past 65, or the month after your job stops. And you have 8 months after that to actually do your initial enrollment period. So I mentioned earlier about how if you don't enroll in Medicare, there is a penalty if you either don't enroll by your 65th birthday within that 3 months after your 65th birthday, or if you don't enroll within that 8-month window past when your job stops or past when your coverage stops. And then that 10% penalty per every 12 months would apply. So you want to make sure that doesn't happen. And in many instances, it's also going to be a cost savings by enrolling in Medicare. I've found from helping a lot of people plan for retirement that one of the number one reasons people try to work to 65 is because of the cost of health insurance. So the next thing you have to think about is if somehow you miss enrolling in those periods, then you'd have to wait until the general enrollment period, which is January 1st to March 31st. And if you would happen to miss enrolling by the initial enrollment period, then you'd have to wait all the way until the general enrollment period, which, depending on when your birthday is, maybe wouldn't be a whole lot of time. But it's possible if you have a birthday towards the middle of the year, you could have to wait to that initial enrollment period, and then your coverage wouldn't start until July 1st. So that's just another reason why you want to make sure you don't miss your enrollment period. And once you're enrolled in Medicare, and you have a supplement plan, you have the ability beginning every October 15th to December 7th to switch your supplemental plans and to switch your drug plans. And this could be, let's say you're in a Medicare Advantage plan and you have found out that the plan is not filling your needs, or maybe the plan has raised their cost, or they've eliminated certain benefits that they're offering. This is your opportunity to switch coverage to either another Medicare Advantage plan, or if it makes sense, to another Medigap plan. Once you start collecting Social Security, then Medicare will take your Medicare Part B premium from your Social Security monthly amount before they either send you the check or deposit the money into your account. But if you've listened to some of my other podcasts, in particular, Episode 4 on when to collect Social Security, you're aware that I usually recommend at least waiting until your full retirement age, if not having the higher earning spouse wait until 70 to collect Social Security. So if you're doing that, then how do you pay for Medicare? Well, you have a few options. One is that they will send you a quarterly bill if you enroll in Medicare and you're not collecting Social Security. And then obviously you need to pay this bill, right? So what happens if you're going to be traveling or you're not home and you don't pay the bill? Then there'd be a lapse in coverage. So you want to obviously avoid having that happen. So you also have the ability to set up what Medicare calls Easy Pay, where they automatically take the money from your bank account on a monthly basis. So I think for most people that would make the most sense if you're enrolled in Medicare before you enroll in Social Security. And in order to enroll in Medicare, you actually go to ssa.gov. Right online, you can apply for your Medicare benefits. You can also call the Social Security Administration, or you can go down to your local Social Security office, though I'm not sure with COVID how easy it is to get an appointment, but that is an option available to you as well. And if you're going to go with a Medigap policy, you might need or want to purchase a supplemental dental or vision plan, and that is something that could be available to you as well. As far as resources that can be helpful, there are some nonprofit groups in certain areas that can help you. Like in Connecticut, there's the Medicare Advocacy Group, medicareadvocacy.org, that you can reach out to for help on selecting the plans. You can also reach out to an independent agent that can help you with the different plans as well. And also, as I mentioned earlier, Medicare.gov is an excellent resource to go to research the different plan options that are available to you. And also talking with friends and family, getting input from them on what plan they're using, what experiences they've had, so they can help you avoid making some of the common Medicare mistakes that people make. So I hope this was helpful to you on understanding the basics of Medicare and getting an understanding of what you need to think about as you approach your age 65 or Medicare enrollment if you're going to work past 65. Thanks for tuning in. And if you're enjoying these podcasts, please leave me a 5-star rating and a review. And if there are other topics that you're interested in hearing about, please reach out to us at retirewithryan.com. Have a great week, and I'll talk to you next Wednesday.
You should consult a financial advisor familiar with your specific circumstances before you make any financial decisions. Nothing in this broadcast constitutes a solicitation for the sale or purchase of any securities. Any mention of rates of return are historical or hypothetical in nature and are not a guarantee of future returns. Ryan Morrissey, CFP, is an investment advisor representative of Morrissey Wealth Management, LLC, a registered investment advisor.